we're going to talk about the complex treatment of mold toxicity. Hi, welcome. I'm Dr. Angela Yeagley.
I'm Dr. Anastasia.
And welcome to Sage Health TV. So today is, I think, super exciting. This is an area, mold toxicity is an area that we have been treating extensively, and we see a lot. And maybe it's because we're in the Pacific Northwest, and there's a lot of, rain here. But we actually think it's a little more prevalent just overall because of the amount of people we see. But so today we're going to dive into treatment, which is actually quite complex and complicated. And so this is going to be a two-part series. So the first part, you can find part one on Sage Health TV, our YouTube channel, and on our blog and our website, sagemedclinic.com. So part one is all about just going over symptoms, like what are the symptoms that we're looking at when we're suspecting mold toxicity, and then what are all the testing that's done, within your home and in your body. So if we're not going to touch on that today, so please see part one. And today we're going to just dive into, why some people are more affected than others and then what we do about it once we find it. So beginning, we're just going to, one thing we were discussing quite a bit before we started today is, why certain people, like we can have a family living in one home and only one person is impacted and having all the symptoms of cognitive change and brain fog and pain or aching.
Yeah, and as Dr. Angela said, it is a really, really complex problem. And, we said mold toxicity, but it's often referred to as mycotoxins as well.
Absolutely.
And that doesn't mean, what that means is that you may not necessarily currently still be exposed to the mold, right? But the body has basically started to store mycotoxins, and those can persist for a long time.
Great point.
Speaking of, you were talking about how one person in a family may be affected. I had a family of four. I was seeing the mother, and she had so many symptoms. She, just this constellation of symptoms that did not all seem connected. A lot of joint, and this was a really healthy younger woman, joint pain, starting to have some sinus symptoms, some gut symptoms, just a lot of stuff, and she had moved into a new home about 2.5 years before. And, so we thought, this doesn't make sense for somebody who's so healthy. And we did a little bit of a background, and turns out that they had serious mold in their house. Her youngest daughter was also ill, but her oldest daughter and her husband were not, whether it's ventilation issues or other things. But it was really interesting to learn that not only the significance or the extremity of the symptoms that show up, but also how we want to treat are very impacted by this.
Absolutely.
Yeah.
And what I found very interesting about, the kind of the treatment that Dr. Jones was doing with this family is that even the dad, of course, living in the same house, same amount of exposure, had less mycotoxins actually in his urine compared to her. It's like her body just kind of shows us her body could not move it out. It was getting stored, and it gets stored in your brain, in your tissues, your organs, your liver, your kidneys.
And when we treated them, his treatment was much shorter, and he resolved and responded much quicker. Of course, they had their house cleaned and remediated, then removed the problem. But and it took her quite a bit longer to really get her to a place where she was healthy again. So it's going to be really different for everybody. How it shows, where their exposures come from. And how it shows up for them, both in testing and symptomatically.
Absolutely, and it can be work too. So you have to keep that in mind. Sometimes the reason the spouse or the partner is not actually showing these symptoms because it's coming from work.
And you bring up a great point, because actually what I've seen in the last year is just a really significant increase in some of these mysterious syndromes that show up secondary to mycotoxin testing, like the chronic inflammatory response syndrome, or the mast cell activation syndrome, or just general symptoms like fibromyalgia and chronic fatigue. And it's because so many more people who were in houses with water damage or molds were home for the last 16 months or the last year, 24/7 in these areas, in this exposure, as opposed to leaving to work and school and all of the things of daily life. So I think that was one of the reasons it really snowballed.
Yeah, I think, and you bring up a couple of really good points that actually people can be diagnosed with like an autoimmune condition and or some other kind of chronic illness, and we find that when the mycotoxins are present, that condition actually can flare and become worse. So people are just thinking, oh, I'm, whether it's Hashimoto's or an MS or Parkinson's, and they're like, oh, my disease is just worsening, and it's like, oh, actually, no, you have this other toxin that is severely impacting you.
Or the underlying trigger, if it's newly onset. So,
absolutely.
Yeah, so that's, we've gone into depth on that.
Yeah, we're good there.
It's just so fascinating.
It is fascinating, and the home thing is too,
So once it's identified and tested for, how do we treat it?
So obviously you have to get away from the mold. That's number one. Talked about that in part one. But really, we both believe that you need to start with the detox pathways, and there's many ways we support that. And so detoxification is just basically the movement, the ability to move any sort of, negative toxin exposure or anything that's not supposed to be in your body out, the ability to get it out of your body. And so that's your liver, that's your lymph system, that's your kidneys, and your overall, we're going to get a little deeper, like it's your overall genetic ability as well. And that comes back to MTHFR, your methylation, then getting a little more into glucuronidation. And so these are like supporting sulfur groups, supporting antioxidants.
A lot of things that we can look at, if somebody if we have that basic information, we can go, oh, look at what pathways may be compromised. How can we further, instead of sort of blindly, just throwing a handful of stones and hoping one of them hits, we're like, okay, we know you need more support on these pathways.
Yes.
And some of them, are going to overlap a lot, right? Like, for example, talking about your favorite, one of your favorites, the sauna, right?
Yes, always.
That's going to help everyone.
Oh, it helps everybody. Yeah, pretty much. Yeah. So that's it. For detoxing, we love adding that as part of our protocol. Infrared sauna, lots of deep sweating. I also really like PEMF therapy. That's the Beamer, and that's pulsed electromagnetic therapy.
And then what we want to do is make sure that people are getting really good support for their liver and their bile, right? Bile is something that people talk about the gallbladder, but we don't really talk about bile very much. And bile is actually a substance produced in the liver that people think about it just for digestion of fat, but what it really does is help emulsify and bind and grab onto all of these different toxins that need to get sort of packaged up and moved out of the system. And so supporting that through different foods, there's all kinds of foods, and we'll get into diet more, but different foods and different herbs, and of course, removing things from our environment, not just the mold we're exposed to, but anything else in our environment that, or that we're putting in that's going to be toxic, right? Like, so excessive amounts of, even moderate to excessive amounts of alcohol, or non-organic foods or sugars, or, once again, we want to cut off the supply of toxins coming in so we can get the outflow.
Absolutely. Yeah. So, for those of you who have done a cleanse or a detox, many times that's what we encourage people to move to, which is, again, we'll get into diet, but a lot of whole foods, as well as like a lot of those herbal liver support what Dr. Jones said. So, so next one is binders. So binders are agents that literally bind to a toxin or the mycotoxin and excrete it from your body. And these are very important with mold toxicity, just because, again, of the ability, once we release these things and we're encouraging the movement out, we need to help you bind them up and get them out through your stool or your urine.
And there's different ones we use. Sometimes, it depends on the person, as always. So a real basic one that most people tolerate really well is activated charcoal. There's zeolite or other types of clay. There's a combination formula. We love GI Detox, which has a little bit of a few things in it. And then there is something called cholestyramine, which is a prescription medication originally designed to bind cholesterol and lower cholesterol. And that one's kind of a big hitter, and it works really well, but it can be a little much for some people. So when we use that for more intense cases, we start small and sort of see how people do with it. And one other big thing, I just want to bring this up, is that A lot of people come in with GI stuff, and if people are not having regular bowel movements or they're constipated and we give them binders, that could be a problem. So the other thing is we really want to make sure that they've got a healthy GI system, that everything's moving and they're eliminating every day. And
that's right. Yeah, that they have good transit time, definitely pooping every day. I mean, that has to happen, so we have to work on that. And then sometimes we assess if people just, if you eat beets and it doesn't show up, for like 24 to 48 hours is something we have to work on too. So
we want to get all the toxins out.
Not
flushing them
sitting
through the
there,
system,
right, in your gut. So